I know I've got the last session of the day. Can you all hear me in the back there? Excellent. And I'm just checking that I've got everything. I'm all ready. Okay, so I'm going to speak up, and hopefully you're not going to fall asleep. Everyone's had their caffeine break, which is great. But I'm going to get going on a topic that is very dear to my heart. So thank you very much for having me here today. So I'm going to kick straight off with a very important fact. Did you know that medical error is actually the third leading cause of death in the United States and in Canada? And that is after cardiovascular disease and cancer. Now, not many people actually know that. And why is that a fact? Well, that's because healthcare systems are complex and they are complicated, right? And they interact with another very complex entity. Anyone? Yeah, I heard it over there, patients, but it's the human body, right? We have over 100,000 kilometers of blood vessels in our body and over 100,000 chemical interactions happening inside our brain every single second. Complexity is most definitely the name of this game. Now, all over the world, healthcare systems are often overburdened and complicated, and that's for both doctors and patients. Whether it's lack of resources, gaps in communication, delays in treatment, and this is where mistakes can happen. We're only human, after all. And that is why it's important to know how to advocate for yourselves and to put your health in your own hands. And a way to do that is what I'm here to share with you today. Healthcare systems, okay, sorry, there was a slide in there I was not expecting, but that's okay, that one. It was black in my previous presentation, it's all good. Healthcare systems care for us from our conception all the way to our demise. And you may have a little bit of interaction with the healthcare system, or you may have way more than you would like for yourself or for a loved one. You may feel 100% confident when you walk into the healthcare system, or it may leave you feeling uncertain, powerless, and afraid. Now, I know those feelings only too well. Let me take you back in time. Right, it's 2010. Kesha's TikTok is blaring on the radio. Yeah. There's an ash cloud from a volcano in Iceland that is causing mayhem with flights over Europe. I know because my husband is stuck in Morocco for a week. And everyone's talking about this new gadget. It's called an iPad? Yeah? Mm-hmm. Well, I have just been diagnosed with a non-malignant brain tumor. I'm a wife. I'm a mother of a 4-year-old son. And I'm a manager at work. Our life has been completely changed by those words. You have a brain tumor? I'm no longer a routine patient. I have multiple specialists, I have multiple appointments, I have multiple medications. It's like a full-time job. I feel powerless, uncertain, and afraid. It's 2 years later, and my brain tumor now doubles in size, and I have a life-saving brain surgery. But if I hadn't been my body's own advocate, and had my family, my support groups, and my doctors at my side, I wouldn't be here today. You see, those complexities of the healthcare system were against me. But before I share the approach that worked for me, I want us all to check our pulses. I mean our active patient pulses. What I want you to do is, if you have your conference bags with you, if you look inside your programs, you will find a leaflet that looks like this. And I want you to turn to the slide that says Active Patient Pulse. If you don't have it, no need to worry. I have it on the next slide. What I want you to do is look through the active patient pulse and the patient activation scale, which you will see over here. There are 4 levels of patient activation. What I want you to do is look through that and think to yourself, where am I on that patient activation scale? And believe me, this is not a competition. I do not have prizes in the back. This is for internal processing only. It's good for us all to have a baseline. So I'm going to give you a minute to review this. So let's start now. How are we doing out there? Enough time? Nod of heads? Yeah? Okay, good. Okay, so having a baseline is very important because it gives everybody a starting point. And no matter where you lie on this patient activation scale, there is always room for improvement. Because given the increase in aging populations and the increase in chronic diseases, every single one of us is going to, if not already, going to be a patient one day. So let's put some tools in your toolbox, but first, I am going to convince you that this is the right thing to be doing. So research shows us that activated patients, meaning patients that have the knowledge, the skills, and the confidence to manage their health and healthcare, have better clinical indicators such as blood pressure. They have better patient experiences with their healthcare team. They seek preventative care earlier, and they engage in healthier behaviors, such as good diet, good exercise. They stick to their treatments that are recommended to them by their healthcare team, and they also have lower costs, such as less hospitalizations, less visits to the emergency room. Now, that's a bonus to the healthcare system, right? Of course. So this sounds like some good data to me on why being an activated patient is a good thing to do. Now, over the past decade, activated patients have become a more common occurrence. We have more information than ever at our fingertips about our health conditions, courtesy of Dr. Google and the internet. And it's also been realized that a collaborative relationship between patient and doctor can have better outcomes. So I think, as I said earlier, this is some good data on why being an activated patient might be the way to go. But I do know starting something new can be daunting. It's like starting that new exercise routine or meditation, right? We know that it's good for us, we know all the benefits, but how do we fit it all into our busy life? How do you shift to being a more activated patient in a simple and easy to remember way, along with life, your lists, apps, hashtags, and everything as well? That's the key question. Now, after my brain tumor diagnosis, crippling fear woke me up one morning, 3 a.m. I went to my computer and I sat in front of it, and I remember researching every crevice of the internet. And I found a Facebook brain tumor support group, and I found some credible and not so credible information as well. I realized at that stage that I needed a more structured approach to help me manage my health care. Something to help me navigate this challenge and just calm my fears. A typical type A personality, I think, at 3 a.m. But anyway, so the system that I developed for myself became what I call my team approach. T, track. E, educate. A, ask. And M, manage. And my family my support groups, and my doctors were a key part of my team. You know, I remember when my husband and I went for my first appointment with my neurosurgeon, he said to me, he said, "Claire, would you like a copy of your MRI for my brain scan?" And I said to him, "Sure." So I took the copy home and I read it, and I learned a lot, apart from having to Google quite a few of the terms, but that was fine. And I took that copy of the report and I put it in a red binder. And the next time I had an MRI, I asked for a copy of it. And where did I put it? In my red binder. Because you see, I had learned the importance of starting to track my medical records, track my medications, track my symptoms, my appointments, all in one place. I had learned how important it was to track the story of my brain and I. The more each of you take the opportunity to track the story of your bodies, the more important it will be. So find those moments to track. In that 3 a.m. session, I also started to educate myself. So at that next appointment with my neurosurgeon, I was able to ask him questions because of some of the information that I had found. And we had a more engaged conversation because I was more informed. So I encourage you to ask your doctor, ask your health professionals about where you can find accurate and reliable information and find ways to become educated. When I was diagnosed, I was told that my treatment was going to be yearly MRIs, and that was the medical standard of care for my condition, the thing that most doctors do. And then my MRIs were discontinued because I was considered to be stable. I wondered about this, and so I asked questions, and I got a second opinion who told me, "No, absolutely, you need to continue yearly MRIs." And I'm glad that I asked. But you know what? Asking questions is not easy. It's hard. And so I started with, why? What if? How can we do this together? When I go to an appointment, I write down all the questions that I want to ask. I prioritize it, and I make sure that I think of ways I can become an asker. And so, for any of you out there, look for ways for yourselves or for the loved one to become the asker. Being a brain tumor patient with multiple specialists, multiple appointments, multiple medications can be overwhelming. It felt like a full-time job. I remember one day just thinking to myself, what is the one thing I wanted from my doctor at my next appointment? And it was, I just want my migraines to go away. And so I made that my objective. I made that my goal for my next appointment. And you know what? Just by simplifying my need and telling my doctor, it made it so much easier all round. It also made it feel less emotional as well. I felt like I was managing my health. And I realized that teams become effective with good management, right? So maybe I could apply that to my health and do the same thing there. I think everybody has taken a step towards managing their health by being at the conference today and listening to me, so thank you for that. So think of one objective that you would like for your health and write that down. Make that your goal for your next appointment with your healthcare professional. Look for ways to be the manager of your health. Now, I told you earlier, I knew that I was the last session of the day. So I know that there might be some people who are sleeping behind open eyes at the back there. So it's exam time. The first person to put their hand up here and answer this correctly gets a copy of my book. What does the TEAM in team approach stand for? Oh, hang on, hands up, hands up. And I saw you. And the E? It's him, he's answering. And the A? Oh, well done. There we go. It's all yours. And let's not forget, is this still on? Yes, it is. Congratulations, thank you. And let's not forget that your family, your support groups, and your doctors are a critical part of the team approach. Without them, it is just not as effective. So that is key to remember, right? So what I wanted to say is, where do you go from here? Where do you start? You may want to grab a team approach. Some of you may already be doing parts of this. You may want to grab a team approach, go out and buy a binder. Some of you may be doing some of this electronically. Or some of you may say, oh, you know what, I'm just going to start tracking. I'm just going to ask my doctor for some part of my medical record. Or I'm just going to ask a question next time. And you know what, that's totally fine. Because each step that you take is a step in the right direction. It's a step towards being more active in your health care. And when you are active, you are being an advocate for yourself or a loved one in a complicated healthcare system. You are able to work with your healthcare team. You're able to connect, communicate, and collaborate with them. With my brain tumor, it was only small mistakes that were made along the way. But if I hadn't been an activated patient, I wouldn't be here today. So please, share this message with your family, with your loved ones, with others that you meet, because we often don't realize just how important our health is until we don't have it. On the back of the handout that you have, there's actually a summary of the key team takeaways for you to put in that toolbox at home. Remember, your health is too important to take lightly. So be proactive, take responsibility, and put your health in your own hands. You never know. You might just save a life. Yours or someone you love. Thank you.